Welcome to this elective course on data management on health crisis. This is part of the O2H Health Crisis Resilience Certificate that is led by European University Institute and University of Los Andes. Health crisis involves making difficult decisions that include to prioritize population, to decide to evacuate a population, to close schools, to stop transportation, to decide where to dispense medication or vaccines, or how to communicate and when to communicate about these outbreaks or these disasters. In the emergency preparedness decision, there are three key processes. One is situational analysis, or understand what is happening and what is the needs. Then action planning, decide where to invest the resources, and process control. And that includes data in inputs, the number of people, the number of blankets we distribute, and the outputs, and that include the population cover in terms of vaccination, for example, and all that will affect in a positive or negative way the health status of the community, reducing mortality, for example. Data from a health crisis can come from different sources: the cases, hospitalizations, deaths, clinical data, symptoms, treatments of the patients, laboratory data, and that includes results of the tests, genotypes, resource data, number of beds, number of intensive care, and surveillance systems to monitor the spread of the disease. And that depends, the kind of data depends on the moment of the crisis. So the preparedness, you will need to know about past epidemics and to what kind of epidemics you can expect, what is the resources you have, for example, number of hospitals or capacity you have in laboratory. During the health crisis, clearly you need to know the number of cases, the admissions, the deaths, and in both preparedness and intervention, you need to have clear data to communicate with the public about the crisis. Sendai Framework for Disaster Risk Reduction 2015-2030 is the first international attempt to systematically measure the effectiveness of disaster impact reduction. They have different indicators. I choose one of them related to mortality. So to reduce mortality related to crises and epidemics. Data require governance, and that includes accountability. So clearly who is responsible, and this entity or person who is responsible provide clear information, and that is transparency, integrity. The data has to be correct, accurate, and complete. Protection. So it's important to protect the privacy of the people, for example, victims or patients. At the same time, need to be anonymized to prevent risk for the people involved. Retention. So it's important that the data is safe and protected for a long period of time, because you can need this data 10, 20 years later. An example of data sources, so we have administrative data that collected in the hospitals, health facilities, census, demographic surveillance, disease registry, environmental monitoring. For example, for malaria, it's important to know the rainy seasons, epidemiological surveillance, estimates, event data, specific for each event like COVID, financial records, geospatial data, legislation, reports, scientific literature, surveys, vital registration. It's only few examples of source of data on crisis. And it's important to know and to guarantee the quality of the data, because if you take decision based on wrong or lack of quality data, the decision can be wrong too. So key elements of that is the data need to be clean, need to be confirmed that the data is collected properly, complete, comprehensive, that the data is collected from all the population that are affected and with the necessary information, credible, because sometimes the data can be collected only with some specific population and not everybody, so that reduces the credibility on this data. Some characteristics of this data quality: accuracy, so the free of errors, at least we can access to this information, and that is related to the concept of open data. Consistency, so if you collect data in 3 different sources, the results has to be the same. Currency, so the data is up to date, and that is related to timeliness. So data that they all is not the best information to take decisions. Granularity, that is related to if you need data divided by age groups or by sex, you have this information. Relevancy, so the data you collect is the data you need to take decisions. Related to surveillance system, there are multiple surveillance systems. I just want to mention a few of them. The Global Public Health Intelligence Network from Canada that monitor outbreaks. PROMET, that is a global program on outbreaks. European Center for Disease Prevention and Control has the surveillance system for infectious diseases. National Syndromic Surveillance Program in the US that follow up public health events, not only outbreaks, but mass shooting, for example, and integrate disease surveillance and response from Sub-Saharan Africa that collect data on different diseases like malaria, cholera, Ebola. I want to mention the Global Disaster Alert and Coordination System, because this system that is a combined effort between the United Nations, European Commission, and disaster managers, provide information on different kinds of disasters, not only outbreaks, but natural disaster, conflict, etc. And we will use this tool in the following weeks. Other tools to collect that data, for example, is Kobo Toolbooks. The Kobo Toolbooks is a powerful tool. It's free. That information. Then we have specific data collection and data analysis. And one good example is related to COVID. There were different tools to analyze the information. The one I prefer is the Johns Hopkins resource for COVID, but the bad news is these resources stopped on March 10 of 2023. Then we have other sources like the World Health Organization continue to provide information on COVID, but it's not as complete, it's not as acute and especially is not as updated like the information that was provided by Johns Hopkins. Other information is the health data or health metrics that is the agency leader on global burden of diseases, and they follow COVID not only in terms of detect mortality in this case, report mortality, but estimate different projections depending on the use of masks, for example, or the use of antivirals or the use of vaccines, what will be the effect of that in the future. And that requires mathematical modelation. There are other sources that I want to mention. One is social media. Social media give a lot of information. So there are multiple examples. In 2014, in the outbreak of Ebola, the information about funeral attendance was key to detect new places with cases in Zika virus. 2016, the traveling information about traveling permits to define, to know time, the follow-up of what people are talking about. So what is the concern was important. That is just a few examples of the use of social media in terms of generate data. And mobile applications, there are multiple tools. Disaster Alert app is one of them that give information about earthquakes, floods, or hurricanes. And you can receive permanent information on that according to the place you are. Crisis response app by Facebook. You can see here that in the case of earthquakes, you can send I'm safe because very often so this works even without these resources. So it's a good app to provide information about if you are okay after an earthquake. And FEMA from the US has an app that allows people to find information about emergency shelter, for example, in the case of tornadoes or hurricanes. Artificial intelligence become a very important tool. Here is the example of ChatGPT, but there are other multiple tools for artificial intelligence to analyze large amounts of data, including social media and search engines data, what people are looking for, and this information is very important to take decision on health crisis, to accelerate the development of treatment for diseases, to estimate the results and the impact of a new treatment or a new preventive action, and develop target public health messaging during health crisis, depending on what people are asking for, what people are concerned on. There are multiple analysis techniques. There are the descriptive statistics, the most common, often used, that include measures like mean, median, standard deviation, and answer three key questions: who is affected, where is affected, and when is affected. So the time, the person are key elements in these descriptive statistics. Inferential statistics, so you have a sample and you estimate according to this sample what is the effect in the whole population. Predictive modeling, that includes more complex analysis like regression analysis, decision trees, and neural networks. Cluster analysis, so you can analyze specific group of population or ethnicity, for example. Association analysis, here is what is related with the crisis, for example, the relationship sheet between floods and cholera could be one example, and that includes causal analysis. What's the cause of the big debate about the cause of COVID, for example. To evaluate the efficacy of COVID, for example, the COVID-19 vaccine and the disease, or reduce the severity of the disease. So that is two different efficacy that have to be evaluated. You need to know if people have already two doses, had booster or not, how often or where these doses, etc. So you need a lot of information. You need to know what vaccine have been used, because there are different efficacy depending on the vaccine and what kind of variant of COVID-19 people have. So all these aspects need to be taken into account when you give information about the efficacy. So this is an interesting study about the depending on, for example, the type of COVID variant. So you can see go from 94% until 32%. So it's the variation are very important. This is another study about floods and cholera. So that is interesting, looking for countries for a period of time, when they have floods and when they have cholera, and you can establish some relations. There are, anyway, most of the cases, floods are related with cholera, but you have cholera without floods or floods without cholera. So you have to be collect the data and be careful how to analyze this information. Thank you very much.